Connecticut has a shortage of certified nursing assistants, especially outside its biggest cities. One small section of a much larger law is trying to fix that. It's Section 34 of Public Act 2612. You may remember PA 2612 from an earlier video. It's the same sweeping 120-page workforce law we covered a few videos back. This time, we're zooming into one specific piece. Section 34 requires DPH to create a grant program aimed at expanding certified nursing assistant training programs. It targets two specific areas: the greater Hartford region and rural communities across the state. Why these two areas? Because that's where the workforce gap is worst. A recent state analysis found nearly 29% of Connecticut's rural residents had delayed needed medical care in the past year, notably higher than in non-rural areas. Part of the problem is capacity. Rural facilities often can't find and train enough certified aides to meet demand. This grant program is designed to fund the training pipeline directly, creating and expanding programs where the need is highest. Here's an interesting twist. The law directs DPH to use, where possible, federal money from something called the Rural Health Transformation Program. That program was created by a 2025 federal law, a nationwide 50-state initiative to strengthen rural health care. In early 2026, Connecticut received its first-year award, $154 million federal dollars. That's actually one of the smaller state awards in the country, second lowest of all 50 states, and the smallest in New England. Still, if similar amounts continue for the program's full 5 years, Connecticut's total could reach roughly $750 million. The Department of Social Services leads the overall program, coordinating about 30 different projects across the state. Workforce development, including training more certified nursing assistants, is one piece of that broader plan. This connects directly to something we covered in an earlier video: Connecticut's expansion of its nurses' aide registry to cover more healthcare institutions, not just nursing homes. Right now, CNA certification in Connecticut is mostly tied to nursing home employment specifically, but hospitals, home health agencies, and hospice organizations all rely on people with the same training and background. Expanding both the training pipeline and the oversight registry together is meant to support that wider range of employers at the same time. Section 34 doesn't set an exact dollar amount for the grant program itself. It's funded within available appropriations, meaning it depends on what the state budget actually allocates. That's a common approach in Connecticut law, creating the authority for a program first, then funding it through the regular budget process. The goal, according to state officials, is straightforward: bring care closer to where people already live, especially in areas that have historically been underserved. Connecticut's Public Health Commissioner said investing in both care access and workforce training gives residents a better chance at staying healthy. For someone considering a career as a certified nursing assistant, this could eventually mean more training programs, more openings, and more support, especially outside Connecticut's major cities. For rural communities and Hartford specifically, it could mean shorter waits and more local access to trained caregivers. It's a small provision compared to some of the higher-profile bills we've covered, but it's part of a much larger, multi-year investment in Connecticut's healthcare workforce. Whether it meaningfully closes the gap will likely take a few years to see. Section 34 of Public Act 2612 directs DPH to fund new CNA training programs in Hartford and rural Connecticut, drawing on a $154 million federal rural health grant. Do you think targeted workforce grants like this are the right way to close healthcare gaps in underserved areas? Let us know what you think. And if you learned something new, hit like and subscribe for more breakdowns of the laws shaping Connecticut.